Hi everybody, welcome to another episode of Anatomy video series, and today we're going to look at the leg bones. And today we're going to discuss two important bones located in the leg, and basically the leg is between the knee joint, as you can see, and the ankle joint. So we have two bones located in this area, which are the tibia and the fibula. And after we discuss these two important bones, we're going to go and look at the foot bones and the ligaments and the ankle joint. We'll give a break before that, and we'll continue with the foot bones. So in the leg we have two important bones, one medially located and one laterally located. The medially located bone is the tibia, as you can see. It's really big, it's a strong bone, and it's basically the second strongest bone in the human body. The first strongest bone, remember we talked about that, the first strongest bone in the body was, which one was? It was what? Of course it was the femur, right? So the femur is the most strongest and the longest and the heaviest bone in human body. The second strongest bone of the human body is the tibia. So due to this important feature of tibia, most of the weight that comes from the upper extremity or upper part of the body, from the femur, directly goes to the tibia, and from tibia through the ankle joint it goes to the foot, and from the foot it goes to the ground. So we can say that the tibia is basically the weight-bearing bone of the lower limb or of the leg, and it's also referred to as shin bone. Okay, I'm gonna show you the crest located in the anterior surface of the tibia a bit later. So this is the medial bone, tibia. Lateral bone, as you can see, we have this fibula, and fibula is basically like a clasp pin shaped structure or brooch. It is also called the peroneal. Peroneal. Okay, so there's also perineal. Perineum means the lower part of the pelvis. Okay, the perineal area is this part here. Okay, this is peroneal, and the meaning of this in Latin is like clasp or brooch pin. It resembles a clasp, like the clasp pin that the woman uses for their hair. Okay, so it resembles, the structure of that resembles clasp pin, the fibula. And we have these articulations of the tibia and fibula together. Okay, over here we have a superior tibia fibular joint, and then we have, okay, the superior tibia fibular joint here is synovial type of joint. It's plane joint, and they have this sliding type of motion here. However, and again, we have another joint at the bottom in the distal part between the tibia and the fibula, which is referred as distal tibial fibular joint, and this is basically a fibrous type of joint, syndesmosis, and it's like it's immovable. However, the tibia does not participate in the knee joint. In the knee joint, like I mentioned earlier, it is basically done by the condyles, the medial lateral condyle of the femur and the medial lateral condyles of the tibia. So this knee joint here is a hinge type of joint where you have the flexion and extension type of motions. All right, and basically the fibula does not participate in the knee joint. Don't forget that, in the proximal part. However, the fibula participates in the ankle joint below. In the ankle joint we have the articular surface of the tibia, and then we have the articular surface of the fibula, articulates with the lower located foot tarsus bone, which is called the talus. So we have the talus, tibia, and fibula come together, and they what we call as talocrural joint, or it is referred to as the ankle joint. So the fibula participates in the distal ankle joint. However, fibula does not contribute to any part of the knee joint. Okay. So what else can we mention about this? And therefore, since the tibia is the heaviest bone, and therefore it's the weight-bearing bone. However, the fibula is basically the function of the fibula here is basically supportive, and most of the muscles of the leg provides attachment point of certain variety of muscles and ligaments. And you also have interosseous membrane between tibia and fibula, which we can't see here, but in the middle here, this opening here, it's covered and occupied by a membrane, and this membrane is called the interosseous membrane. So basically, the borders between the tibia and the fibula, the borders that face towards each other, they're also referred to as interosseous borders, and interosseous borders are basically occupied by the interosseous membrane. And that is also syndesmosis of fibrous type of joint, which is not movable. Okay, and so therefore the fibula is basically it's not weight bearing. It doesn't have any weight bearing function. Primarily, it serves as a supportive type of function and bears or function as providing attachment points for a variety of muscles in this area. And it was also said in clinical work that fibula is also is important in providing the reconstruction, bone grafting, or bone reconstruction surgery. So they get part of the fibula and do this clinical work and like bone grafting, and basically there's no deficiency in any functional aspect of the leg or the foot. So that's about it here. So let's look at the individual structures and features and depressions and protrusions closer view, and we're going to focus on these particular structures now. Okay, let's start. Hi everybody. Let's look at a closer look at the tibia now. So this is tibia, and as you can see, has a proximal end, a distal end, and an intervening shaft or a body in the middle. And the proximal end, as you can see, it's wider, okay, and distal end, it's narrower. And in terms of the side determination, the laterality, or right or left, we have to look at a couple of characteristics of the bone. One of the important thing that you need to remember is at the front. Okay, this is the anterior view of the tibia. We have this tuberosity here. We have the tubercle, big tuberosity. This is called the tibial tuberosity. So just beneath the condyles, these are the condyles of the tibia. Just beneath that, you have this protrusion of a bony protrusion, which is called the tibial tuberosity. That's one. So tibial tuberosity should be located on the anterior aspect. So you don't have a tibial tuberosity on the other side. So this is smooth. So anterior tibial tuberosity is located on the anterior side. That's one. Second, on the medial side, you have this malleolus. You have this, again, bony protrusion. This bony protrusion, this is called the medial malleolus. All right. So this is medial malleolus, it's medial located. So this is medial located. You have the anterior protrusion. You have the tibial tuberosity. That's second. And third important characteristic is that on the anterior surface you have a border, and this border here is really sharp. It's crest-like, right? And so this is the anterior border of the tibia. It's sharp and crest-like, and basically you can feel this on your leg. Okay, it's subcutaneous. You can feel it. It's really sharp. So this is anterior located. However, on the posterior aspect, you don't have that. So this is smooth. So you have three characteristics. By going with these three important classification of features, you can recognize this as being a right or left tibia. So by looking at this, going through these three characteristics, we can say that this tibia is basically the left tibia. Why? Because we have the tibial tuberosity here. We have the crest-like a border on the entry surface, and then we have this protrusion, this malleolus is located medially. So this is the medial malleolus. So basically, this is left tibia. We can say we can bring this to the right. Okay, so if this is the right tibia, right, the medial malleolus can be directed on the right side, correct. But, however, we don't see the other two important characteristics. We don't see the tibial tuberosity, and we don't see the anterior sharp border. Okay, so this is the posterior border. Okay, so we don't see these two characteristics. So this is not the right tibia. So this is the left tibia. Why we have the tibial tuberosity and the anterior sharp crest here. Okay, so this is the left tibia. This is the side termination. Okay, let's examine first the proximal end of the tibia. So the proximal end of the tibia, as you can see from the bird's eye view, from the top view, we have these condyles. Okay, so these condyles, basically, when you look at it from, okay, this is the front view. So when you look at the top, all right, so it's like a plateau. So it's also referred to as tibial plateau, because it's like, you know, flatty area. But the area that is disrupted is in the mid part, where you have these tubercles or eminence. But generally speaking, it's like a plateau. So it is also referred as tibial plateau. And so what are these called? These are basically referred to as condyles. So we have two condyles, medial condyle and lateral condyle. How do I know this is a medial condyle? I have to look at the medial malleolus. Okay, so this malleolus or medial malleolus is located medially. So this part here is medial located. Okay, so this is the medial condyle, and therefore the other one is called the lateral condyle. Okay. And we can also say that, for instance, let's look at this. For instance, this. Okay, so we have the tibia, and then we have the fibula. Tibia is always medially located in the leg. However, the fibula is located laterally, like I told you earlier. So therefore, and then you have the so we have the medial malleolus. Okay, so this is the anterior aspect of the tibia. So this is the right leg or left leg. Since this is the medial malleolus, this is right leg. All right. So we have on the right leg we have the medial malleolus, tibia located medially, and fibula is located lateral. So this is the right leg. So if this is the right leg, and if this is the tibia, therefore this is the lateral condyle, and this is the medial condyle. So medial condyle, why? Because we have the medial malleolus over here, and lateral condyle, why? Because it's very close to the fibula. So this part here is laterally located. Medial condyle, lateral condyle. Okay, good. So here, medial malleolus. So this is the medial condyle, and this is the lateral condyle. So these condyles, like I said, these are articular facets which articulate with the condyles of the femur, like so. Okay. So these are the condyles of the femur, and they articulate and they form what we call as the knee joint. Okay, so these two condyles articulate the condyle of the medial condyle of the femur articulated with the medial condyle of the tibia. The lateral condyle of the femur articulate with the lateral condyle of the tibia, what we call as the knee joint. All right. So if we look at the condyles in detail, we would see that there's in the middle there's impression. For instance, this is the medial condyle. Okay, so there's an impression or depression in the center of the condyle. However, in the periphery it's flat. All right. So in this depression area, the condyles of the femur basically comes direct contact with this area in the center. However, in the periphery, you have these menisci. Okay, so So you have the medial meniscus, and then we have the lateral meniscus. Medial meniscus is located in the medial condyle. Lateral meniscus is located in the lateral condyle. So where the meniscus is located, the condyle, the femur, does not directly contact with the condyle of the tibia, where you have this meniscus in between. However, in the center, in this depression, the two basically bones meet each other, and there's a cartilage. There's an articular cartilage there, by the way. Okay, so we have the medial condyle and lateral condyle, and in between these two condyles we have the intercondylar area. This area here is called the intercondylar area, and on the posterior mid part we have these two tubercles. We have the medial tubercle of the medial condyle, and then we have the lateral tubercle of the lateral condyle here. Okay, so and basically these tubercles make up the eminence, what we call as intercondylar eminence. And this area is important and serves attachment for our cruciate ligaments and cruciate ligaments, yeah. And it also serves attachment for the menisci, and we're going to look at that. So in the intercondylar area, we have three structures that attach anteriorly and three structures that attach posteriorly. So what are they? Let's look at them one by one. So here, round about here, we have the anterior horn of the medial meniscus, the attachment of the anterior horn of the medial meniscus. And just behind that, so we have the oblique line. So at the front, most anteriorly, we have the anterior horn, attachment of the anterior horn of the medial meniscus, and then we have the anterior cruciate ligament, and then we have the attachment of the anterior horn of the lateral meniscus. Okay, so this attachment of the anterior, let's look at it again. Attachment on the anterior surface, you have the attachment of the anterior horn of the medial meniscus, attachment of the anterior cruciate ligament, and then we have the attachment of the anterior horn of the lateral meniscus. So this is the lateral meniscus here. Okay, so behind that, okay, then we have going from anterior to posterior, then we have the attachment point of the posterior horn of the lateral meniscus, posterior horn lateral meniscus, and then when over here on the medial side we have the attachment of the posterior horn of the medial meniscus, all right, and at the back here, around about here, we have the posterior cruciate ligament attachment point. So we have three on the anterior side and three on the posterior side attachment sites, where in the intercondylar area or intercondylar eminence. All right. So let's recap and repeat it once more. So on the from the anterior to posterior, we have the attachment point of the anterior horn of the medial meniscus, and then behind that we have the attachment of the anterior cruciate ligament, and then we have the attachment of the anterior horn of the lateral meniscus, and then we have the attachment of the posterior horn of the lateral meniscus, and then we have the attachment of the posterior horn of the medial meniscus, and at the back here we have the attachment of the posterior cruciate ligament. Okay, so we have these attachment points. All right, so these are the condyles area. What else do we have here? We have on the anterior aspect here we have this protrusion, bony protrusion, and this is called, like I said, this is tibial tuberosity. All right, so we have in tibial tuberosity we have the smooth part here on the top, and at the lower part we have the rough area. On the smooth part we have the subpatellar bursa, and at the lower part we have the attachment point of the patellar ligament. Okay, so patellar ligament basically is what? Patellar ligament is, so you have, if you look at this, so we have this is the patella, all right? So you have the gastrocnemius muscle coming in, and they form tendon, and they cover this patella, the tendon, and through the patella they form a ligament, and this ligament basically diverges and come together, and they form a ligament, and ligament attaches to this tibial tuberosity. All right. So basically, the gastrocnemius attaches through patella to the tibial tuberosity. All right. So basically, patellar ligament, right? It is a ligament. Why? Because it attaches bone to bone. But it can also refer to as tendon. Why? Because it's part of it's part of the quadriceps muscle, and it basically houses the patella, and therefore patella is also regarded as a sesamoid bone. Okay, so via the patellar ligament attaches to the rough portion of the tibial tuberosity just below, and the tibial tuberosity serves as attachment point for this ligament, and therefore to the quadriceps muscle. Okay, so that's that. So coming to this, so what else do we see here? Okay, on the medial side of the medial condyle here, so you also have the attachment points of certain muscles. One of the muscles here is semimembranosus. We're going to look at that later on. So this is the attachment point of semimembranosus, and also we also have on the medial side we have attachment points for, again, certain muscles like Sargent SGT, sartorius gracilis, and semitendinosus. And this is also referred to as pes anserinus. So we're going to look at that later on in our future lectures. Pes anserinus, the goose foot. It resembles a goose foot. That's why it's referred to as pes anserinus. And it's like sartorius gracilis and semitendinosus attached to the medial side of the tibia. And on the lateral side, we have this tubercle here. This is called the anterolateral tubercle of the lateral condyle here. Anterolateral tubercle on the lateral condyle on the anterior lateral surface, and this serves attachment for the iliotibial tract. So you have the iliotibial tract coming in and attaches to the on the lateral surface, anterior lateral surface of the lateral condyle, and basically serves the increases the stability of the knee joint on the lateral aspect, and that is called the iliotibial tract attaching to this particular area. So that's the proximal end of the tibia. Let's go to the shaft now, the body. As you can see here, let's look at the let's look at with the fibula. So if you look at the tibia on the medial, so this is the right leg. Okay, so on the medial side you have the tibia, on the lateral side you have the fibula. Okay, so you have the anterior border here. So this is the anterior border. This is the medial border, and this is the lateral border. Lateral border is also referred to as interosseous border. Interosseous border basically attaches to the interosseous border of the fibula. So this anterior border is really sharp. It's crest-like, as you can see. It starts from the lower end of the tibial tuberosity, goes all the way down, and it goes all the way down to the anterior surface of the distal end. And basically, this sharp crest-like structure, it's subcutaneous, and basically, please everybody feel your own anterior border of your tibia, which you can feel. It's really sharp, okay, and it is also, this is why it is referred to as shin bone, because of its crest-like, being a crest-like or having a sharpy, a pointy border or area. So this is the anterior border, okay. So this is the interosseous border here, or lateral border, and this here is the medial border. All right, and therefore we have the anterior surface, we have the medial surface, and then we have the posterior surface. So we have three surfaces, three borders of the tibia, and these surfaces and borders basically serves attachment point for many muscles, like tibialis anterior serves attachment point for the lateral surface here, or anterior surface, yeah, lateral surface, and then we have the tibialis posterior serves attachment point on the posterior aspect of the tibia. And on the posterior aspect, one other thing that you need to remember here is a line here, which is called the soleal line. And soleal line basically moves from the lateral to medial. So this is the medial malleolus here. This is the medial side. So you have the lateral to medial. There's a line here. This line is called the soleal line. And the reason why it is referred to soleal line is because basically a muscle called soleus muscle basically attaches to this line here, soleus muscle. And just above that, you have this area, popliteus muscle also attaches to this area. So you have the popliteus muscle. This area is called the popliteal region, and you have the soleal line and soleus muscle attached to this area. And basically you have this posterior surface. And this posterior surface, we have the posterior tibial muscle serves attachment site or has the attachment site of this surface of the tibia. Okay. So that's the shaft and the borders of the tibia. Okay. And okay, let's look at the distal end of the tibia now. So you have the surface. So you have the anterior surface, posterior surface, medial surface, lateral surface, and then you have the superior surface, which is forms the articular facet here. So the medial surface is occupied by the malleolus, and this is called the medial malleolus. So basically, this is the left leg, and this is the left tibia, and you can feel your medial malleolus here or on your own ankle. Okay, it's a sticking out, protruding type of bony part on the medial side of the ankle, and that's medial malleolus. All right, and medial malleolus serves attachment site for a lot of ligaments, and it's very important to stabilize the ankle joint. That's the medial side of the distal end. The lateral side of this end, as you can see here, it's a triangular. It forms an articular facet. This is a fibular facet where the fibula, distal end of the fibula, attaches to this area here. This is the facet for the fibula. So let's look at over here. So this is the right leg. This is the tibia. This is the fibula. All right. So this is the medial malleolus. You can feel on your own bone, and you have the articular facet here, or fibular facet here, and where the fibula attaches to this triangular area. And this is basically a syndesmosis, a fibrous joint, syndesmosis type of joint, and there's no movement in this area. By the way, I forgot to show you the articular facet of the head of the fibula on the proximal end, on the lateral surface side. So on the lateral side, okay, this is the medial side here. Okay, this is the medial condyle. On the lateral just on the posterior lateral aspect here, this is the facet for the head of the fibula. So let's look at over here. So it's over around about here. So it's on the lateral side, the posterior lateral side of the lateral condyle. Just beneath that, you have the articular facet for the head of the fibula here. And basically, this is the proximal tibiofibular joint. So we have two tibiofibular joints. We have the proximal tibiofibular joint, and then we have the distal tibiofibular joint. Proximal tibiofibular joint is a synovial type of plane joint. It's movable. It's like, gliding type of movement. It's very small. It's very and you can ignore it, but it's like very small plane type of gliding type of motion here. It's a synovial joint. However, in the distal tibiofibular joint here, it's fibrous and it's non-movable, and it's syndesmosis type. All right. So we have articulation of tibia and fibula on the distal side, and also we have the articulation of with tibia and fibula on the proximal end. Okay. So, and we have the articular surface here, which articulates with the trochlea of the talus. So basically, the talus articulates with the tibia and the fibula, and with this articulation we have the talocrural joint, or the ankle joint, that forms by the tibia, the fibula, and the talus. Three bones come together, they form this, what we call as the ankle joint. Okay, so that's basically tibia. All right. So that's it, I think, tibia. So let's move to the next bone, which is the fibula. All right. Like I said, fibula. It's like druch, synonym of druch, or pin-shaped bone. Like I said earlier, it's like primarily supportive type of motion or function, supportive function, and and it's located on the lateral aspect of the tibia. As you can see, it does not contribute to the knee joint. However, it is very important in stabilization of the knee joint. All right, as you can see here, let's look over here. So this is the knee joint here, as you can see. So this is the talus. This on the medial side, this is the tibia, and on the lateral side is the fibula. So the lateral aspect of the talus is joins with the fibula, and the superior aspect of the talus primarily joins with or articulates with the tibia. So they basically form this talocrural joint or the ankle joint. And this ankle joint basically is important in this type of it has a hinge type of joint. This is hinge joint, and primarily you have the extension and flexion type of joint. Okay, so of motion. I'm sorry. So this is so this is, if this is an anatomical position, you have flexion, extension, okay. So we have this type of work. So this is like flexion and extension, or it is also referred to as dorsiflexion, plantar flexion. Like if it moves upwards, this is dorsiflexion. Why? Because this is the dorsal part of the foot, and this is the plantar side of the foot. So if it moves upwards, it is also referred to dorsiflexion. If it moves downwards, it's called the plantar flexion. So, or this is can be referred to as flexion or extension. Okay, so don't get confused. So this is flexion, extension, or dorsiflexion, plantar flexion. Okay. All right. So fibula, like I said, it has a head. Okay, let's look at over here. So it's very difficult to to say the lateralization or side determination, but you can do that. I'm going to show you that when they're together with the tibia. However, the head, as you can see, is like quadrangular. It's like, it has multi protruding outreached areas. It's like quadrangular shaped. How this is the proximal end of the fibula, the head of the fibula. However, this distal end, as you can see, it's pointy. All right, it's pointy. It's pointed downwards. That's the distal end. The proximal end is quadrangular, as you can see. This is the head of the fibula. All right. Other thing is that you have the pointed part, and this pointed part is basically called the lateral malleolus. So the medial malleolus is from the tibia. However, the lateral malleolus is part of the fibula. And then you have in the lateral malleolus on the inner aspect, we have this smooth triangular area, and this is the articular facet. And then we have the fossa, and this is the malleolar fossa, which serves attachment to the ligaments. This medial triangular facet serves attachment to the tibia. It attaches to the tibia. Just posterior to that, you have this fossa, and this fossa serves attachment to the ligaments. Okay. So if you look at, basically, let's look at over here. So this is the right leg, all right, and this is the medial located bone, which is the tibia. Lateral located bone, which is the fibula, right? This is the head of the fibula. This is the neck. This is the body shaft, and this is the distal end or the lower end of the fibula. The proximal end of the fibula, as you can see, the head, does not participate in the knee joint. It only articulates with the medial condyle, just on the inferior surface of the medial condyle, forming the superior tibiofibular joint, which is the plain synovial joint. And one of the important clinical aspects of the neck of the fibula is that the common peroneal nerve basically circulates and moves around the neck from the posterior to anterior. Okay, and as a location, it comes from the posterior aspect and it moves towards the anterior aspect and curves around the neck. Okay, curves around the neck of the fibula, and then comes anteriorly. And why is this important? It is important because when there's a fracture, the neck fracture, because of the bone, it's very thin, and it's most vulnerable fracture in the neck region. So when this fracture occurs, most likely you would damage the common peroneal nerve. So when the common peroneal nerve is damaged, you have the deep peroneal and superficial. It has two branches: deep peroneal, superficial peroneal. Superficial peroneal innervates the lateral compartment muscle, which is the peroneus longus and brevis. The deep peroneal nerve innervates the extensor, the anterior compartment muscle, which are the extensor muscle, which are the extensor digitorum, digitorum, and extensor hallucis longus, extensor digitorum longus. And these two extensor muscles extends the foot, okay. And the lateral compartment muscle, which is the peroneus longus and brevis, everts the foot. Basically, what happens that these muscles does not work. So when they don't work, you don't have an extension of the foot. Let's look at over here. In this, so you have these muscles coming in that are innervated by the deep peroneal nerve or superficial peroneal, or basically the common peroneal nerve. So these muscles come in here and they basically extend. Primarily, they extend the foot. Okay. And they extend the foot. So when these muscles don't work, you don't have an extension. So what do you have? You have full flexion. So you don't have an extension. You have full flexion. So what does this mean? It basically means that it drops, and this is referred as foot drop. Okay. So this is referred to as foot drop. So this is the anatomical position. Okay, so it goes like this. So you have a drop of the foot because you don't have an extension, foot extension, and this is damaged. So basically, the foot drops backwards. You have a foot drop because of the non-functional activity of the common peroneal nerve, because of the fracture of the neck of the because of the fracture of the neck of the femur. Okay, that's the clinical aspect of the femur. One other clinical aspect I forgot to mention was in the tibia, and just beneath the tibial tuberosity. Okay, here you have the growth plate. Okay, and you have the growth plate, and what happens is that since the quadriceps muscle, tendon, and ligament attaches to the tibial tuberosity, and with this muscle basically pulls and extends the leg like this, and this is done via when you walk, when you kick, when you do sportive activities. Basically, this tendon and ligament works, and therefore it pulls the upper part of the tibia. And since there's a growth plate, growth plate is cartilaginous, okay, and it pulls the upper part of the cartilaginous growth plate upwards, and therefore you have this irritation or inflammation, and you have an increased amount of pain and swelling due to slight damage to the growth plate. Okay, so and this is called the Osgood-Schlatter diseases or condition, where you have high amount of pain and swelling. But this basically goes away when this growth plate of cartilage basically transforms into bone after a certain age, like 18, 19, when the longitudinal growth basically disappears or comes to an end. But before that, you have this, and in terms of like 10 years old or 15 years old, the kids with like adolescent kids with high activity of sports. Of these people, you have this increased amount of pain. Okay, we'll talk about this detail in lecture. All right, so that's that. Going back to the fibula, so we have in the fibula again we have these three borders and three surfaces. We have the anterior border, we have the posterior border, we have the interosseous border here, and then we have the we have the lateral surface, the anterior surface, and the posterior surface. All these surfaces and borders basically serves the attachment point for the For the muscular group, we have the lateral compartment muscles, we have the anterior compartment muscles, and then we have the posterior compartment muscles. They all attach to the fibula. Okay, one of the important muscles that attach to the head of the fibula is biceps femoris, and also lateral collateral ligament attached to the head of the fibula. Okay, that's about it for the fibula, I think. Yeah, that's about it. Okay. Yeah. Now, before I'm going to start with the foot. Yeah, and let's take a couple of minutes break, or we can just go ahead. Yeah. Let's take a break. Couple of minutes break, and I'll go ahead and start with the foot bones. Okay, now we're going to look at the foot and the ankle joints and the associated ligaments. Okay, so basically this is the foot. So this is either right or left foot. Okay, so first what we have to look at is the thumb side. Okay, so this is the thumb side. And this is the big toe. Well, when I'm saying thumb, it's a big toe. The big toe is referred to as hallux, and in the hand, the thumb is called pollex. Okay, and in the foot, it's called hallux. So this is the big toe. All right, and so this is the right foot. All right. And basically, it's composed of the tarsal bones or tarsus, as composed to the hand. We have the carpal or carpus. So they have this is the tarsal bone. This is the metatarsus or metatarsal bones, and these are the phalanges. And so this is the same as the hand. So we call them phalanges, and again here in the foot. It is also referred as the same names, the phalanges. But however, in the hand we have the in the foot we have the metatarsal, and in the hand we have metacarpals. That's the difference. And in the tarsal we have tarsal in the foot, and we have carpus or carpal bones in the wrist. Okay, in the hand. And one of the difference of the amount of the bones of the foot and the hand, it would be the number. In the tarsal bones, we have 7 tarsal bones in the foot. However, we have 8 bones in the carpal bones in the hand. So there's 7 here, and there's 8 in the hand. So therefore, totally there's 1 missing in the foot than the hand. So we have 7 tarsal bones, we have 5 metatarsal, and then we have 14 phalanges. All right, and it makes so there's 14 and 5 would be 19. 19 plus 7 will be 26. So there's 26 bones in the foot, and there's 27 bones in the hand. That's the primary difference. And so let's look at these bones one by one. So we have start with the tarsal bones. So these are the tarsal bones, and just like in the hand, we have the proximal row. We had the proximal row and distal row in the carpal bones of the hand. Here, we have a proximal, and then we have distal row, and one of the bones here, which is located intermediately. So we can regard this as a proximal. We have 2 bones make up the proximal bone, and the other bones would be the distal, or we might regard one of these bones as an intermediate. So the proximal bones starts with the 2 important bones, with the talus and calcaneus. So basically, if you look at on the medial side, it's like this. This is talus, this is calcaneus. If you look at on the lateral side, so this is the talus, Okay, and this is the calcaneus, all right? And basically the calcaneus, as you can see, is the bone which attaches or touches the ground. Calcaneus, and this is the heel, what we call as the heel bone. Okay, the heel bone. And yeah, okay. So the next bone would be navicular, which is this. This is the navicular bone, all right. And the distal row is comprised by, starting from the medial going towards the lateral, is a cuneiform. So we have the medial cuneiform, intermediate, and lateral cuneiform, or we can name that as one as first, second, third. First cuneiform, second cuneiform, or third cuneiform. Mostly it is referred to as medial, intermediate, and lateral. And going towards the lateral side would be the cuboidal bone. So the most lateral tarsal bone on the distal row would be the cuboid. So from medial to lateral, it's counted again, and the distal row would be the medial cuneiform, intermediate cuneiform, lateral cuneiform, and the next would be the cuboid. All right. The intermediate would be the navicular, and the proximal row would be formed by these two important bones, would be the talus and the calcaneus. All right. As you can see, and then the distal row of the tarsal bones are attached to or forms articulation with the metatarsal bones. So naming these metatarsal, going from medial to lateral, remember we named the metacarpal bones in the hand starting from the lateral to medial. So in anatomical position, the thumb is located on the lateral side. Here, the big toe in an anatomical position is located on the medial side. All right, so in the foot, the big toe is referred to as the number 1 tarsal, and then we have the second metatarsal, third, fourth, and fifth metatarsal. Okay, so that's how we name it. So we name it from medial to lateral. So this is the first metatarsal, second, third, fourth, and fifth metatarsal, and these metatarsals are just like the hand metacarpals. It is formed by the base and the body and the head. So this is the base, and this is the body, the shaft, and this is the head of the metatarsals. Okay. And so, and then when we get to the phalanges or the digits, again the same, but just the same as the hand. We have 3 phalanx, but on the big toe we only have 2 phalanx, proximal and distal. Again, we have the base, the body, the shaft, and the head of the proximal phalanx, and then we have the same similar things: the base, body, and the head of the distal phalanx. So we have the proximal phalanx, distal phalanx. However, in the other digits, we have the proximal, the middle, and distal phalanx of the second, third, fourth, and fifth digit of fingers. Okay. And one other extra thing, when we look at the plantar aspect of the foot, we have 2 sesamate bones located in the dorsal aspect of the first metatarsal. So this is the first metatarsal. Okay, this is the big toe, the hallux, and this is the head. So basically, the dorsal aspect of the head of the first metatarsal, we have the 2 sesamate bones, and we have the flexor hallucis longus tendon. Basically, attaches and goes houses these 2 sesamate bones and attaches to the phalanx. Flexor hallucis longus tendon encompasses or covers these 2 sesamate bones located in the head, the dorsal aspect of the head of the first metatarsal. That's the sesamate bones. Okay, one of the clinical aspect is that the second metatarsal here, as you can see, it is stabilized on the lateral, medial, and proximal aspect of variety of bones here. So, and it is the longest of metatarsal, the second metatarsal, and therefore this part here is stabilized. Okay, it's fixed, and this part is the movable part. So since it's long, all right, and this part is stabilized, and this is the most important bone that undergoes fracture when there's a high amount of weight in this particular area. So this goes, because it's the distal part of this second metatarsal is most movable. However, the proximal part is so fixed, so it's most vulnerable to fractures. All right. So as you can see, the talus here, it articulates with the navicular at the front, and below it articulates with the calcaneus below, and here it articulates with let's look at over here. It articulates above with the tibia, okay, and the fibula. So this is the trochlear surface, and articulates with the tibia, the articular surfaces of the tibia, talar articular surface of the tibia, and articular surface of the fibula, forming the ankle joint. So this is the ankle joint, forming flexion and extension around this joint. This is the hinge joint. This is also referred to as talocrural joint, formed by these three important bones. All right. Okay, just behind that, okay, we have these calcaneus, and then we have the a ligament, which, one of the important ligaments, attaches to the edge of this calcaneus bone. We'll talk about that later on. And so we have this navicular articulates with the three cuneiform bones, the medial, intermediate, and lateral cuneiform. And as you can see, the first cuneiform articulates with the first metatarsal, second, or the intermediate cuneiform articulates with the second metatarsal, the third, or the lateral cuneiform articulates with the third metatarsal. However, if you look at the cuboid, okay, so let's look at over here. Okay, so this cuboid, as you can see on the lateral aspect of the foot, it articulates with the two metatarsals. And in the fifth metatarsal, you have this styloid process type of protrusion of the bone. And it's subcutaneous. You can feel this bony protrusion, and this can also be fractured with the high amount of weight-bearing activities. So cuboid articulates with the fourth and fifth metatarsal over here. Okay, one of the clinical aspects of the foot is we have three important arches on the medial side. You can see it. So the foot basically stays on the ground like so. So you have the arch here. Okay. So it's like an arch, and this arch is called the medial longitudinal arch. The medial longitudinal arch basically comprises the bones that come together on the medial side of the foot. So all this, the bony pyramid or the bony constructional or structural that come together, they form this arch. Okay, circular arrangement. And with this arch, basically, when there's a high amount of weight passing through the tibia end of the foot, when it fixes on the ground, it goes like so downwards, and therefore the weight passes to the ground and then basically jumps back to its original anatomical position. So that's how the weight is basically transmitted to the ground. So we have the medial longitudinal arch, and then we have the lateral longitudinal arch over here. There's another arch on lateral side, again formed by these bones here, like calcaneus. You have the cuboid and the fourth and fifth metatarsal. So you have another arch here. Lateral longitudinal arch is a bit lower and basically slightly attaches to the ground. However, the medial longitudinal arch is much higher, and it does not attach in a normal anatomic position. It does not attach to the ground. So that's medial longitudinal arch, the lateral longitudinal arch, and then we have the transverse arch. Transverse arch is like the bones that is composed of these the cuneiforms and the proximal part of the metatarsals. Okay, cuneiforms, cuboid. So you have this transverse arch. Okay, it's like this. So this bony structure makes an arch, and this arch is basically composed of these cuneiforms, cuboid, and the proximal part of the metatarsals make a transverse arch. So we have three arches. We have the medial longitudinal arch, lateral longitudinal arch, and then we have one transverse arch. Okay. Okay, that's about it here. Let's look at the ligaments, right? So let's look at the ligaments. In the ligaments, so this is the tibia, this is the fibula, and by the way, this is the interosseous membrane here. All right, and we have three important ligaments that attaches the fibula to the talus. We have the fibulotalar ligament, anterior fibulotalar ligament on here. So this is the anterior and this is the anterior fibulotalar ligament. This is the posterior fibulotalar ligament. This is the posterior fibulotalar ligament. Right. This is the transverse ligament, by the way. This is the transverse ligament. And what else? And then we have the inferior ligaments. We have the inferior anterior. This is the inferior anterior tibiofibular ligament. This is the inferior posterior tibiofibular ligament here. So this tibiofibular ligament attaches the fibula to the tibia, anterior and posterior, but this is the inferior ligaments. We also have superior ones. And then we have, so these ligaments attach the fibula to tibia, and then we have the ligaments that attach the fibula to the talus. Right? This is the anterior talotibular ligament, and this is the posterior talofibular ligament over here. That third ligament is over here is the fibular calcaneofibular ligament. Okay, these three ligaments are important, and these three ligaments important in when the ankle is spranged. Remember when you have eversion of the foot. So basically, this ankle joint, you have like I said, you have the extension and flexion, or dorsiflexion, or plantar flexion. That's one. Primarily, the ankle joint does these motions primarily, but also you have eversion and inversion, eversion. Sorry, inversion moves the palm of the foot. Looks on medial side. However, in inversion, you slightly turn your palm of your foot laterally. So it's an eversion, and this is inversion. So slightly inversion also is accomplished in this ankle joint. And in terms of inversion, okay, when you walk and run or jump or when you fall down, so you accidentally evert your foot, okay, and it's overextended. So therefore, the ligaments, especially the lateral fibular ligament, which is the talar fibular, the anterior and posterior talar ligament and calcaneofibular ligament. These three ligaments basically get spranged. When they get spranged, basically they get torn. So if it's torn, it's spranged. And then there's also a word called strang. Strang is like, stretched. If it's overstretched, you can also have these swelling and severe amount of pain too. But if it's sprang, it's like small tear occurs in these three ligaments, and we call it what we call as the sprained ankle, especially these three ligaments. Okay, so on the lateral side we see these three ligaments. So we have the anterior talofibular, posterior talofibular, and you have the calcaneofibular ligament. These three ligaments are very important. If you look at the medial side, we have the deltoid, what we call it. So this is the tibia. Okay, so this is the medial malleolus. By the way, these three ligaments basically attach, as you can see, from the lateral malleolus to the tibia, to the talus, and from lateral malleolus to the calcaneus. So lateral malleolus, basically, of the fibula forms attachment site for these important ligaments. On the medial side, we have again medial malleolus, again forms attachment site for important ligaments, and one of the important ligaments is deltoid ligaments. So all these ligaments that we see here, like these tibio-talar, tibio-talar, we have anterior posterior tibio-talar, and then we have tibio-calcaneal ligaments. Okay, and then we have tibio-navicular ligaments. Okay, let's say it again. So we have anteriorly we have the tibio-navicular, tibio-talar. So this is the talus, okay? Anterior tibio-talar. Then we have posterior tibio-talar. That's one. Okay, anterior and posterior tibio-talar. And then we have tibio-calcaneal on the medial side. And then we have the tibio-navicular. This is navicular bone here. So we have tibio-navicular ligament. So, and if you look at the shape of this, it's like triangle or pyramidal shape. It's like deltoid muscle. And if you look at the shape of the deltoid muscle, it's triangular or pyramidal shaped. And that's why they call it as deltoid ligament. So basically, the deltoid ligament has 4 components. So we have the anterior and posterior tibio-talar, and then we have tibio-calcaneal, and then we have tibio-navicular ligament that forms up the medial aspect of the ligaments, which also is collectively referred to as a deltoid ligament. And this can also be sprained or get torn due to overuse or due to overextension. Okay, that's about it, I think. Okay. All right. Thank you very much for listening. So we're finished the leg bones and the foot bones, and associated joints and ligaments. So I think we finished the lower limb extremity bones. So next video would be on the axial skeleton, which would be the vertebrae, vertebral column, and the ribs and sternum. And after that, we have the skull, and after that, we'll be over of the bone subject committee. Thank you very much. Thank you very much for listening. Bye for now. Study hard. If you have any questions, I'll be around. Bye bye.